I am going to touch you, and I want you to tell me how many spots you feel and if you can feel it on both sides or not.
Both sides. One side.
One or two feelings.
One. Two. Two.
On one side or both sides?
Both sides.
Okay. So his sensation. Okay, now we're going to check the quadricep reflex. Okay? Just going to hit your knee and see how well your reflexes are. Okay?
I think that.
This one was about a 1+ reflex. This one was about a 2+ reflex. Okay, now we're going to check the bicep reflex. I'm just going to take his arm here and I'm going to tap on my thumb and see if I feel a positive reflex. Okay, it was normal to some degree. The bicep flexed and there was slight extension of the arm. After doing this, I'm going to repeat this step on the other arm. Okay, now we just finished checking the other tricep reflex. Now we're going to check the brachial radius reflex. Okay. There was a positive reflex, I would say, about 2+. Okay, now we're going to check the Achilles reflex by tapping the back of the ankle. Okay, there was a positive Achilles reflex in this foot, and we're also going to check the other foot too. Okay, now we're going to check for clonus. I'm going to just relax your leg. Move the foot up and down for a couple of times. Then I'm going to hold the stretch. Okay, and I felt the contractions of the calf muscle, which is a positive clonus effect. Okay, now we're going to check abdominal reflexes. I'm going to take a tongue blade and stroke the side of the stomach and observe the stomach to see if there's contraction of it. Okay, there is a positive abdominal reflex noted. Now we're going to check for plantar reflex.
Rick. Tickle.
Okay, there was a normal plantar reflex noted. We're going to check the musculoskeletal system, and we're going to start with the temporal mandibular joint. So I'm going to place my fingers right here, and I want you to open and close your mouth for me. Okay, movement is smooth. I don't notice any clicks of any sort. Now take your jaw and move it from side to side, like this. Like, not like that, but like with your jaw, like. Just do it like that, yeah. And stick it out.
I did a good job there.
No, it's fine. Okay, that was normal looking. I note that there's no swelling or masses noted. The skin is pink and warm to the touch, but not hot. So everything looks normal. Okay, now we're going to check the muscles along the jaw for firmness and make sure that they're equal on both sides. So clench your jaws together for me. Okay, they feel normal on both sides. Try to move your jaw towards my hand against my resistance. Okay, and on the other side. And now out. Okay, now try to open your mouth against my resistance. Okay. The muscles felt equal on both sides in firmness, and he had good resistance and was able to open his mouth and push against my resistance, so everything was normal. Now we're going to check the cervical spine. It should appear in a straight line, but it deviates some to the right. And the head is erect in alignment somewhat with the spine. I'm going to feel around the shoulders and neck. I want you to tell me if it's sore or tender, any of these places that I'm feeling. Is it sore?
No.
Is your neck sore?
Right there.
Right there?
Right there.
Can feel that the neck is a little bit swollen in this area, but no masses noted anywhere. The skin is pink and warm to the touch and is not radiating any heat. So that's normal. Okay, now we're going to check range of motion of the cervical spine. I want you to touch your chin to your chest. There you go. Now look up towards the ceiling as far as you can go. Okay, and touch each ear to the side of your shoulder. Like this. Don't move your shoulders though, just try to touch your ear to your chin. Okay. Okay.
Oh,
Turn your head from side to side. As best as you can. Okay. Okay. Alright, now we're going to do it against my resistance, okay? Okay, now I'll try to look up towards the ceiling. Okay. Okay. He was able to maintain motion against my resistance, but there was some slight deviation in being normal as far as being able to have full range of motion. Okay, now we're going to inspect the shoulders. I'm feeling the joints, making sure that I don't note any fluid present. I don't feel any masses. They're equal in symmetry and contour. Skin feels warm, pink to the touch, no heat noticed. Is there any tenderness when I palpitate your shoulders?
no,
No? Are you having any pain anywhere in your shoulders?
no.
Alright. Okay, now we're going to check range of motion of the shoulders. The first move I want you to do is move your shoulders back like this. Okay. That's good. I'm also putting my hand on here when he moves to note any crepitus or anything along those lines when he moves, but it felt smooth. Okay, now I want you to take your hands and put them behind your back like this. Okay, that was normal, and he was able to do that. Now I want you to take your hands and go like this. Good. And then take and put them behind your head like this. Okay, the patient had good range of motion in his shoulders. Now we're going to check the elbow joint for any noted redness, swelling, fluid. In the flex position, now we're going to do it in the extended position. That feels normal. The skin is pink and warm to the touch with no heat noted. And everything feels normal, and we'll test this on the other arm as well. Now we're going to check range of motion with the arm and the ability for the patient to have good muscle strength by checking the resistance. Okay. We're going to extend the arm. That was actually flexing the arm. Now we're going to extend the arm. Now we're going to try to do this against my force. So try to flex your arm now. Strong. Now we're going to extend your arm. Okay. Range of motion and muscle strength are normal, and we're going to test this in the other arm as well. Okay, now we're going to check the joints of the wrist and hands. I'm going to palpitate and check for swelling, tenderness, any nodules or lumps noted along the wrist and hand and finger muscle or joints. Feeling that the skin feels warm with no heat present, no signs of infection, no nodules or lesions noted. The contour and symmetry looks normal. Nodule or the joints within the fingers feel a little enlarged. Are they tender when I touch them?
Mm-hmm.
Okay. Do you have some arthritis?
Mm-hmm.
Okay. The joints of the fingers are a little enlarged and uneven, but the patient states that he has arthritis. But they're not sore or tender right now? Okay. Besides that, everything else looks normal, and we'll check this on the other hand as well. I want you to take this hand, your right hand here, and bend it up at the wrist, like this. Keep it straight though, and bend it up like this. Up. Can you bend it up? Okay. Now I want you to bend the hand down at the wrist, like this. Good. Bend the fingers up and down, each one. Okay.
Not bad, yeah.
Okay, I want you to take your fist and go like this and open it. Okay, now close your fingers all together like this and open them. Close, open. Okay. And now I want you to take your thumb and try to touch it to the base of each finger. And to the top of each finger. Alright. The range of motion in the fingers was good, but there's slight decline in motion of the wrist. Okay, after checking range of motion in the other hand, we're now going to check muscle strength in the wrist. So I'm going to apply pressure against your hand, and I want you to try to flex your wrist up. Good. Good muscle strength noted in this arm, so we'll check the other arm as well. Now we're going to do the Fallon test. We're going to do this by taking the back of each hand and putting against each other like this. And we're going to hold this for 90 seconds. Try to make your elbow 90 degrees. Okay. Okay. No symptoms were noted, so that's normal.